Welcome, everyone, to another deep dive. Today, we're taking a plunge into the, well, surprisingly complex world of cattle skin diseases.
Mm-hmm.
Our mission, as always, is to take your sources, break them down, pull out those critical insights, maybe some surprising facts, and, the practical takeaways that really matter for you.
Yeah.
This isn't just about spotting a rash, right? It's kind of a shortcut to understanding how the skin often gives us the earliest, most visible clues about the entire well-being of a cattle operation.
You've hit on the core idea perfectly there. What's often overlooked is just how interconnected these conditions are. They're rarely isolated problems.
Right.
Instead, they're deeply tied to, overall animal husbandry, environmental factors, management practices, all of it.
Mm.
You can almost think of the skin as a sentinel. It's often the first place to show signs when something deeper isn't quite right with the herd.
Okay, a sentinel. So if the skin is a sentinel, how significant are these dermatological conditions, in the grand scheme of things? Why should someone really care about a skin issue when they're managing a whole herd?
Well, the ripple effects are pretty profound, actually, even if they're not immediately fatal.
Okay.
We're talking about tangible losses, things like reduced weight gain, decreased milk yield, permanent hide damage that really hits the market value,
Oof, yeah.
and, of course, the increased cost of treatment.
Mm-hmm.
So, while an animal might not die from a skin condition, its impact on the producer's profitability and, importantly, animal welfare is substantial, really substantial.
Given that, how do you even begin to, categorize and understand such a diverse range of problems? I mean, you mentioned everything from microscopic mites to visible tumors in the sources. Is there a logical way to group these, or is it just kind of a chaotic mix?
That's a really good question. And thankfully, yeah, there are clear categories that help make sense of the complexity. We'll explore the major types: bacterial, viral, fungal, parasitic, and then the non-infectious diseases.
Okay.
What's crucial to grasp, though, is that they often interact. They don't exist in a vacuum. One issue can easily predispose an animal to another, creating a really complex picture sometimes.
Okay, right. Interactions are key. Let's start digging into the specifics then, maybe beginning with bacterial infections. From the material, it seems these are among the most frequently encountered issues, often popping up when the skin's natural defenses are, well, compromised.
That's exactly right. They're typically opportunistic pathogens. They're basically just waiting for an invitation.
An imitation.
Yeah, which usually comes in the form of a breakdown in the skin's natural barrier.
Right.
Things like prolonged moisture, physical trauma, those ectoparasite bites we mentioned, or even just a dip in the animal's immune system
Yeah.
that can create the perfect entry point for bacteria.
Okay. And one of the most common bacterial conditions mentioned is dermatophilosis. It's often called rain scald or even lumpy wool disease.
Huh.
Sounds particularly problematic in, high rainfall areas.
It is, absolutely. And the reason it's so pervasive in wet conditions comes down to this unique disease triad.
Triad.
Okay. First, you need that prolonged moisture.
Mhm.
It really softens the skin and crucially activates the bacteria. Second, there has to be some kind of breach in the skin. Even a tiny scratch or an insect bite can be enough.
Right.
And third, the bacteria itself, Dermatophilis congolensis, has this fascinating trick. Its motile zoospores can actually swim towards carbon dioxide being released from the skin's surface.
Wow.
Yeah, seeking out those compromised sites for invasion. It's like a tiny moisture-activated skin-seeking missile, basically.
That's surprisingly sophisticated for a bacteria. So when all those conditions align, what does dermatophilosis actually look like on the animal? What's the giveaway for you?
That's the striking part, really. You'll often see these very distinctive paintbrush lesions. Yeah, where the hairs are matted together with this sticky exudate. And if you peel back the thick, crusty scabs that form, you'll find a moist, sometimes even purulent, like pus-filled surface underneath. They most commonly show up along the animal's back, the dorsum, and also the head and neck.
And it sounds like this isn't just an ugly cosmetic issue then.
All far from it. The economic impact is significant. You get permanent hide damage, which lowers the value of the leather.
Right.
And you get production losses because, well, affected animals just aren't thriving. A real advantage with this one, though, is how quickly you can often get a definitive diagnosis.
How's that?
Just by looking at a sample under the microscope, the bacteria have this very unique railroad track appearance. It's quite characteristic.
Huh. Railroad tracks. Okay.
Uh-huh.
So the prevention strategy seems almost, well, disarmingly simple then. Get animals to a dry environment, control those ectoparasites, manage abrasive vegetation maybe.
Pretty much. Those are the key environmental controls.
And for handlers, a crucial reminder from the sources, it can be zoonotic, so gloves are definitely a must.
Absolutely essential. Protect yourself.
Okay, let's pivot then to another common group, staphylococcal dermatitis and folliculitis. These are often caused by Staphylococcus aureus, which surprisingly is like a normal resident on an animal's skin.
That's the key paradox, isn't it? It's
Mhm.
typically an opportunistic infection. So the real insight here for you is that if you're seeing these issues, something has likely breached that protective skin barrier.
Okay.
Common predisposing factors are, again, things like ectoparasite bites, trauma, maybe poor hygiene in the environment, or excessive moisture. Clinically, you might observe folliculitis, which is like small bumps, papules, progressing to pustules right around a hair shaft.
Right.
Or you might see what are called epidermal collarettes, these sort of circular lesions with peeling skin, almost like a little collar of scale.
What I found particularly compelling in the research, though, was the point that when this condition shows up on the udder and teats, it's described as a significant warning sign. Why is that so critical?
That's a major red flag. Because those lesions, they become a persistent reservoir for Staphylococcus aureus.
Okay, a
So
resident.
why does that matter so much? Because S. aureus is a leading cause of contagious mastitis.
Ah, mastitis. Yeah.
Exactly.
Right.
Which is far, far more economically devastating to a dairy operation than just the skin lesions themselves. So udder dermatitis is often a sentinel, like we said, for a much bigger problem lurking.
Wow.
And effective diagnosis often requires bacterial culture now, especially to guide treatment because we're seeing increasing antimicrobial resistance.
Yeah.
You need to know what you're dealing with.
Makes sense. Okay, then there's cutaneous actinobacillosis. This is caused by Actinobacillus lignuraceae. And many of us probably know this bacteria from wooden tongue, right?
Right.
But it can show up on the skin too.
Indeed it can. Its opportunistic nature is, again, fascinating. It usually starts with some kind of trauma, perhaps from coarse feed getting into a small wound. And then you get these characteristic deep pyogranulomatous inflammatory lesions. If they happen to drain, you might actually see small, gritty sulfur granules in the pus. They look like little yellow grains.
Sulfur granules.
Yeah.
Okay. And you mentioned differentiating it from lumpy jaw.
Right. A key difference from actinomycosis, or lumpy jaw, which is caused by a different organism, Actinomyces bovis, is that actinobacillosis almost always affects the soft tissues, whereas lumpy jaw typically involves the bone itself, usually the jawbone.
Gotcha. Soft tissue versus bone. And just to quickly touch on them, cellulitis and subcutaneous abscesses are also common bacterial infections, sort of non-specific, resulting from everyday skin breaks.
Exactly. The distinction there is mainly important for treatment. Cellulitis is more of a diffuse spreading infection under the skin, usually needing systemic antibiotics,
Okay.
whereas localized abscess, a pocket of pus, often needs to be lanced and drained properly. And the simple preventative measure here is just good aseptic injection technique. Always use clean needles, clean the skin site. It prevents a lot of trouble.
Basic hygiene, fundamental. All right, let's shift gears now into the highly contagious world of viral skin diseases. The sources suggest these can spread rapidly and often come with pretty significant economic consequences.
Yeah, they definitely can. They tend to move quickly through a herd.
And right at the top of that list seems to be lumpy skin disease, or LSD. The sources really highlight this as economically devastating and a transboundary disease of increasing global importance. That sounds serious.
It is extremely serious. The lumpy skin disease virus is behind it, and its rapid spread, often over vast distances, is primarily due to blood-feeding arthropods,
Like what?
biting flies, mosquitoes, ticks. They essentially act as mechanical vectors hitching a ride for the virus.
Yeah.
It's a disease that really doesn't respect borders at all.
Wow. And what's the hallmark symptom for LSD? Is there one thing that just screams lumpy skin disease to a producer or a vet?
Yes, there is a clinical sign that's considered pathognomonic.
Pathognomonic. Okay, fancy word.
Yeah, it just means it's so incredibly unique and specific to this disease that once you see it, you pretty much know what you're dealing with.
And that is?
It's the appearance of multiple firm, painful cutaneous nodules. They can range from tiny half-centimeter bumps up to, say, 5-centimeter lumps, and they involve the full thickness of the skin.
Full thickness. Okay.
And then these nodules can undergo necrosis, meaning the tissue dies, forming what are called sit-fasts, these hard, dead plugs of skin. Eventually, they slough off, leaving behind these deep, permanent scars.
That sounds absolutely brutal for the animal. What's the wider impact then economically?
The economic fallout is severe, really severe. You see a marked reduction in milk production, significant weight loss, infertility issues, abortions.
Wow.
Irreparable hide damage, obviously,
Huh.
and it can trigger really strict trade restrictions between countries or regions. So it's a huge blow. The most effective control measure, which really underpins prevention in endemic areas, is vaccination.
Vaccination is key for LSD. Okay. Another common viral skin issue, especially in younger animals apparently, is bovine papillomatosis or warts.
Ah yes, warts. These are actually benign skin tumors caused by various types of bovine papillomavirus, or BPV. They're typically transmitted via direct contact between animals or through contaminated fomites.
Mites, like.
Things like halters, grooming equipment, fences, feed bunks, anything an infected animal might rub against. The virus does need a small break in the skin to actually establish an infection.
And the good news is,
Well, what's interesting, and often a relief for producers, is that most warts are self-limiting. They tend to spontaneously regress, just disappear on their own, usually within about 1 to 12 months.
okay, so patience is sometimes the best approach there. Now, for dairy operations especially, teat infections seem like a constant headache. The pain, the interference with milking, and that increased risk of mastitis we talked about. The sources distinguish between two main types, pseudocowpox and bovine herpes mammalitis. Can you break down the key differences for us?
Yet distinguishing them is pretty crucial for appropriate management on the farm. So, pseudocowpox, that's caused by a parapox virus. It often leaves a very characteristic lesion as it heals.
Oh,
It's often described as a horseshoe or ring-shaped scab. Basically, the lesion starts healing from the center outwards, leaving this ring shape.
okay, horseshoe scab.
Right. The challenge with pseudocowpox is that immunity isn't very long-lasting, so you can get these chronic recurring problems in a herd. And yes, as the name suggests, it can be passed to humans, causing what are called milker's nodules on the hands.
Ouch. And the other one, bovine herpes mammalitis.
Bovine herpes mammalitis, or BHM, is caused by bovine herpes virus 2, BHV2. This one is generally more acute and often much more severe. You see these painful thickened plaques develop on the teats, which rapidly form fluid-filled vesicles, or blisters.
Blisters, okay.
And these then break open, leaving quite raw, deep ulcers. These lesions are really prone to cracking and bleeding, and they make the cows intensely resist milking because it's so painful.
Yikes. And for either of these, there's no specific antiviral treatment, right? Which really just underscores the importance of strict hygiene during milking.
Absolutely critical. Things like isolating affected cows if possible, milking them last, meticulously disinfecting milking clusters between cows, and definitely using disposable gloves are all key to stopping transmission within the herd. Hygiene is paramount.
Got it. Okay, let's shift our focus now to fungal foes and parasitic pests. The sources indicate these are incredibly common and cause a lot of irritation, damage, and, yeah, significant economic loss, too.
Very common problems.
First up is dermatophytosis, which most people probably know as ringworm. Highly contagious fungal infection primarily caused by trichophyton varicosum affecting both skin and hair.
That's the one. And what often surprises people is just how incredibly hardy those fungal spores are.
Hardy how?
They can survive in the environment, embedding on wood, on equipment, for years.
Wow.
Literally years.
Years.
Yes. Which makes indirect transmission via those fomites, brushes, halters, walls, post a major factor in its spread. You see it most prevalently in calves and young cattle, especially when they're housed in crowded conditions during winter.
Why winter?
Well, a lack of UV light, which can kill spores, and often higher humidity inside barns, seem to contribute. It creates the perfect breeding ground.
And importantly, the sources stress it's highly zoonotic, so it poses a significant risk to anyone, farmers, vets, family members in close contact with infected cattle.
Extremely zoonotic. Anyone handling affected animals needs to be very careful. The classic lesion itself is quite distinctive.
How so?
It's typically a circular, often raised, hairless patch, and it's usually covered with this thick, gray-white crust that looks almost like asbestos.
Asbestos-like, okay.
Now, while it is often self-limiting, meaning it will eventually clear up on its own, treatment with topical antifungals like washes or creams and, crucially, environmental decontamination are absolutely necessary. You have to kill those spores in the environment to limit spread and protect other animals and people.
Right, decontamination is key because those spores last so long. Okay, moving on to mange, which is skin disease caused by parasitic mites. The sources detail three main types. Can you walk us through them?
Certainly. So first, there's sarcoptic mange. This is caused by burrowing mites, Sarcoptes. It's generally the most severe form, causing intense itching or pruritus and really thick wrinkled crests. Thankfully, it's the least common, but it does have zoonotic potential. It can cause a temporary itchy rash on people.
Okay. Severe but less common. What's next?
Second is seroptic mange, caused by Seroptes ovis. Now, this one is highly contagious and historically has been very economically significant, especially in beef cattle. These are surface-dwelling mites, but they pierce the skin to feed on lymph fluid.
Ouch!
Yeah, it causes severe itching and leads to the formation of large, thick, exudative crusts, often starting on the withers and back.
Got it. Highly contagious surface mites. And the third type?
Finally, we have coreoptic mange, caused by Coreoptes bovis. This is actually the most common type of mange in cattle, particularly in dairy breeds. It causes a milder dermatitis because these mites are surface feeders, mainly on skin debris.
Milder, okay.
Often it's subclinical or just causes some scaling and mild itching, typically around the tailhead, udder, and lower legs, sometimes called leg mange.
So sarcoptic is deep and severe. Seroptic is surface but severe itching. Coreoptic is surface and milder but common. How do you definitively diagnose these tiny culprits? And what's the standard treatment approach?
Diagnosis is confirmed by actually finding the mites. You need to do skin scrapings and look under a microscope. For the burrowing Sarcoptes mites, you need a deep scraping, deep enough to get a little capillary blood oozing.
Okay.
For the surface dwellers, Seroptes and Coreoptes, superficial scrapings collecting scale and crust are usually sufficient. Treatment typically relies on acaricides medications that kill mites. Macrocyclic lactones, like ivermectin or moxidectin, given as injectables or pour-ons, are common and generally very effective choices.
Right, those MLs are pretty standard. Okay. Lice infestation, or pediculosis. Another widespread problem, particularly common in winter, it seems. And we're talking about two main types here.
That's right. You have chewing lice, which belong to the genus Bovicola, formerly Damolinia, and they feed mostly on skin debris, scales, and hair. Then you have sucking lice, general like Lindignitis, Hematopenis, and Selenopotes, which, as the name implies, pierce the skin and feed on blood.
And the impact, is it just annoyance?
Well, even the chewing lice cause significant irritation. That leads to restlessness, rubbing, hair loss, and a generally unthrifty appearance. But with the sucking lice, especially in heavy infestations, the blood loss could be quite substantial.
Substantial enough to cause
anemia, yes, which directly impacts the animal's growth, milk production, and overall health and productivity. It's a real drain.
Okay, so lice are more than just an itchy nuisance. And of course, we can't forget ticks. They're important ectoparasites themselves, causing direct harm through irritation, blood loss, hide damage. But also, crucially, they're vectors for numerous diseases.
Exactly. Ticks are a huge issue globally, both of the direct effects and the diseases they transmit, like anaplasmosis and babesiosis. But if we're talking specifically about parasites causing significant hide damage, we really have to talk about hypodermosis.
Hypodermosis, that's the warble fly infestation, right? Caused by Hypoderma species.
Precisely. Hypoderma bovis and Hypoderma lineatum. What's truly remarkable, and maybe a bit horrifying if you think about it too much, is their life cycle. It involves this remarkable and lengthy migration of the larvae through the host's body.
How lengthy? Where do they go?
The young larvae, after penetrating the skin where the eggs were laid on the legs, migrate internally for months. H. lineatum typically goes to the wall of the esophagus, while H. bovis often migrates to the epidural fat surrounding the spinal canal in the back.
Whoa! Esophagus and spinal canal.
Yeah, that's where they overwinter. Then, in late winter or early spring, they migrate again, this time to the subcutaneous tissue of the back, where they finally cut breathing holes in the skin and form those characteristic lumps or warbles.
Wow, that is quite a journey for a larva. So what's the economic fallout from this complex life cycle?
It's massive. Historically, it was a huge problem. The direct economic impact comes primarily from the hide damage. Those breathing holes the warbles create permanently reduce the hide's value for leather.
Right, holes in the leather.
Exactly.
Yeah.
There's also carcass trim needed at slaughter to remove the affected tissue around the warbles. Beyond that, there's the whole gadding behavior you see in cattle during the summer when the adult warble flies are active and trying to lay eggs.
Gadding.
That frantic running, tail swishing, kicking, trying to escape the buzzing flies. It significantly disrupts grazing time and behavior, leading to reduced weight gain and milk production, just pure stress.
So how on earth do you manage something with such a bizarre and internal life cycle?
It comes down to critical timing for treatment. Systemic insecticides, particularly the macrocyclic lactones again, are very effective, but they need to be applied at the right time.
Which is
Typically in the autumn, after the adult fly season is over, but before the larvae reach their overwintering sites. The goal is to kill the young migrating larvae.
Okay, autumn treatment. Why is timing so critical?
Because, and this is crucial, you must avoid treating during the late winter period when the larvae are in those sensitive overwintering sites near the esophagus or spinal cord.
Why? What happens if you treat then?
Killing large numbers of larvae in those locations can trigger a severe host inflammatory reaction around the dead parasites. If they're near the esophagus, it can cause swelling and potentially bloat. If they're in the spinal canal, it can cause inflammation leading to neurological signs, even paralysis. So timing is absolutely everything with warble fly treatment. You treat early in the autumn.
Wow, okay, that's a really important management point. Let's shift gears one last time now to the non-infectious skin diseases. These are incredibly important too, right? Because they often act as clear indicators of maybe underlying systemic issues, metabolic problems, nutritional deficiencies, or even environmental triggers that your herd might be experiencing.
Exactly. They're like clues the body is giving you about something else going on internally or externally.
First up is photosensitization. And the sources are very clear. Let's be crystal clear right away. This is not sunburn, right?
Correct. That's a common misconception. It's an abnormal skin sensitivity to UV light, yes, but it's caused by the presence of photodynamic agents within the animal skin, which then react with sunlight.
Photodynamic agents. Where do they come from?
Well, the most common type by far, and the one that really tells you something bigger might be wrong, is hepatogenous photosensitization. Hepatogenous meaning originating from the liver.
So it's a liver problem manifesting on the skin.
Precisely. It's a direct consequence of liver damage. When the liver is compromised, it can't properly excrete phyloerythrin. Phyloerythrin is a potent photodynamic agent that's actually a normal breakdown product of chlorophyll from the plant's catalete. If the liver isn't working right, phyloerythrin builds up in the bloodstream, circulates to the skin, and then, when exposed to UV light, it triggers this damaging reaction. Common causes of the underlying liver damage can be certain toxic plants, like lantana camera, or specific mycotoxins found in moldy feed.
And what does this look like clinically? Are there telltale signs that scream liver problem rather than just, say, a simple skin irritation or actual sunburn?
Oh yes, the clinical signs are truly striking and highly diagnostic. The key is their distribution. They are strictly limited to non-pigmented, meaning the white areas of skin or sparsely haired skin that gets direct sunlight exposure.
Like where specifically?
Think the muzzle, eyelids, teats, and udder, especially in white cows, the vulva, and sometimes along the back line if the hair is thin. You'll see intense redness, edema or swelling, and severe itching. In really bad cases, the affected skin can actually die off, become necrotic, and slough away. It looks terrible.
Ouch. So management is pretty clear then. Immediate removal from sunlight is paramount. Then you need to identify and remove the offending plant or feed causing the liver damage and provide supportive care for the animal's skin and liver.
Exactly. Shade is the first step, then diagnostics to find the underlying cause.
Okay. Next, let's talk about nutritional dermatosis, specifically something called zinc-responsive parakeratosis. Zinc, apparently, plays an absolutely critical role in maintaining healthy skin.
It truly does. Zinc is involved in so many enzymatic processes related to skin cell growth, keratinization, and immune function in the skin. What's interesting about zinc-responsive skin disease is that there are two main underlying causes.
Two causes.
Yes. It can be a simple primary dietary deficiency, meaning the animal just isn't getting enough zinc in its feed ration. Or, quite fascinatingly, it could be a hereditary genetic disorder.
A genetic disorder causing skin problems.
Yeah, it's often referred to as lethal trait A46, and it's seen particularly in breeds like Holstein Friesian and their crosses. In these animals, there's a genetic defect in their ability to absorb zinc from the intestines, even if there's adequate zinc in the diet.
Huh. So diet or genetics. And what are the telltale symptoms of zinc deficiency manifesting on the skin, regardless of the cause?
You'll typically see very characteristic lesions. They tend to be symmetrical, meaning they appear similarly on both sides of the body. They're often thick, scaly, and crusted.
Where do they usually show up?
Common sites are around the muzzle, eyes, ears, the back of the legs, the scrotum, and along the neck. Beyond just the skin, these animals often show poor growth. They might lose hair, and they're often immunocompromised, making them more susceptible to other infections like pneumonia or scours.
Right, so skin signs plus poor doing. Okay, finally, for the non-infectious issues, let's briefly touch on allergic and hypersensitivity dermatitis, which is basically, when the immune system overreacts to something.
Exactly, an inappropriate immune response. Probably the most common allergic dermatitis we encounter in cattle is insect bite hypersensitivity.
Like sweet itch in horses.
Very similar concept, yes. It's thought to be an allergic reaction, often to the saliva of biting insects like culicoids, midges, stableflies, or hornflies. This causes intense itching, or pruritus, and subsequent self-trauma as the animal rubs, scratches, and bites itself, trying to get relief.
Any other common allergic reactions?
Another manifestation you see sometimes is urticaria, which most people know as hives. These appear as sudden, transient, raised, flat-topped plaques or wheals on the skin. They can be caused by various things: insect bites, drug reactions, feed changes, contact allergens. They usually appear and disappear relatively quickly.
And for these allergic type reactions, it sounds like the cornerstone of management is really trying to identify and avoid the trigger, especially rigorous insect control for that insect bite hypersensitivity.
Absolutely. Allergen avoidance is key, though often difficult. So robust fly control strategies are really important for managing insect hypersensitivity. For urticaria, if you can identify the trigger, removing it is a goal. Sometimes antihistamines or corticosteroids might be used for symptomatic relief in severe cases.
Okay, so let's try and bring all of this together now as we wrap up. The recurring theme throughout this whole deep dive, it seems, has been the multifactorial nature of these skin conditions and really how skin health directly reflects overall herd health. It's truly fascinating how a small lesion on the skin can potentially tell you so much about what's happening deeper.
It absolutely is. And what's often overlooked, I think, is that many of these infectious dermatological conditions aren't just about the pathogen simply being present. They're often indicative of a failure of the host's defenses, which is usually precipitated by some kind of underlying management stressor.
Can you give examples of that connection again?
Sure, think about it. Dermatophilosis, the rain scald, it thrives on moisture and skin trauma, often management or environment related. Staphylococcal pyoderma often signals underlying hygiene issues or maybe parasite problems compromising the skin. And as we discussed quite pointedly, udder dermatitis can actually foreshadow a full-blown, costly mastitis outbreak. The skin is basically shouting about these deeper problems if you know how to listen.
Right. So if you're a producer or a vet looking at your herd and you see these signs, how do you even begin to approach diagnosis systematically? What's the logical way to figure out what's actually going on amongst all these possibilities?
Well, you really start with a thorough investigation. A comprehensive herd history is paramount. You need to ask about diet, housing, environment, any new animal introductions, recent treatments, vaccination status, parasite control, the whole picture.
Okay, history first.
No.
Then,
A meticulous dermatological examination of affected animals. You need to identify the type of primary lesions. Are they papules, pustules, vesicles, nodules? And the secondary lesions, crusts, scales, ulcers, hair loss. And critically, what's their distribution pattern on the animal's body? Symmetrical, along the back, legs only. This gives you huge clues.
and then what diagnostic tools are actually at your disposal to confirm things?
For initial, often in-house diagnostics that you can do quickly, you have tools like skin scrapings, remembering deep for burrowing mites like sarcoptes, superficial for surface dwellers like coreoptes or fungi. Cytology, just pressing a slide onto a lesion or exudate, is fantastic for rapid identification, like finding those railroad tracks for dermatophilosis or bacteria and inflammatory cells in pyoderma. And a simple KOH preparation can help highlight fungal elements from hair or scale.
Okay, scrapes, cytology, KOH prep. What if you need more?
For more definitive answers, especially if things aren't clearing up or if resistance is suspected, bacterial or fungal culture and sensitivity testing are essential. And honestly, a skin biopsy, taking a small piece of affected skin for histopathology, is often the most valuable diagnostic tool for complex or unusual cases. It gives you a definitive tissue diagnosis.
Biopsy for the tough cases. And herd level.
For some diseases, especially viral ones like LSD or maybe screening for carriers, herd-level diagnostics like serology, blood tests for antibodies, or PCR testing can be really powerful tools.
It sounds like ultimately then the answer isn't just chasing after each individual skin problem with a specific treatment, but really looking at the bigger picture of prevention. The principles of integrated herd health and biosecurity seem to be the core message, almost synonymous with just practicing excellent overall animal husbandry.
That's precisely it. That's the foundation. If we think about the key pillars of prevention for skin diseases, they overlap almost entirely with general good management.
Like what specific?
Well, robust environmental management is huge. Ensuring clean, dry, well-ventilated housing, reducing overcrowding to minimize contact and moisture buildup. It's about optimized nutrition, making sure the diet is well balanced with adequate energy, protein, vitamins, and especially those trace minerals critical for skin health like zinc and copper.
Okay, environment.
Nutrition. A strategic, consistent ecoparasite control program is absolutely non-negotiable. You have to control flies, lice, mites, and ticks. Strict biosecurity practices are vital, maintaining a closed herd if possible, or having rigorous quarantine and testing protocols for any new animals coming in.
Biosecurity, right.
Minimizing stress through low-stress handling techniques, proper facility design, comfortable transport. Stress impacts the immune system, making animals more susceptible. And of course, tailored vaccination programs where effective vaccines are available, like for LSD in relevant areas, or maybe clostridial diseases that can sometimes have skin manifestations.
So as we wrap up this deep dive, it really does circle back beautifully to that initial idea of the skin as this incredible sentinel, doesn't it? It's constantly giving us these updates, these signals about the animal's internal state and its external environment.
It truly is. And perhaps this leaves us, and you listening, with a final thought to ponder. While specific treatments can certainly target individual lesions or infections, the ultimate, most effective long-term prevention of the majority of skin diseases in cattle isn't really about finding a magic bullet cream or injection for each specific ailment. Instead, it's fundamentally about mastering those foundational principles of animal husbandry we just discussed: the environment, the nutrition, the parasite control, the biosecurity, the low-stress handling. So the question to mull over is, how might really focusing on getting these seemingly simple day-to-day practices right truly transform all aspects of your herd's health and productivity far, far beyond just improving the appearance of their skin?
It's a fantastic thought to leave you all with, and one that really underscores the profound interconnectedness of animal health. Thank you so much for joining us on this deep dive into the world of cattle skin diseases. We hope you found it insightful.